Hello, good evening, and welcome everyone to this online postgraduate information session titled Advancing a Career with the MSc in Public Health, where we will talk about the MSPH program at the International Medical University in Kuala Lumpur. This forum is the last of a series of information sessions we have conducted all through this week, where we've been talking about all the different postgraduate programs we offer at IMU. I am Dr. Mohammed Suhail, Senior Lecturer at the Department of Public Health and Community Medicine at IMU, and I am your host and moderator for this session today. Some basic housekeeping rules for today. We have muted all the microphones for the attendees. For any questions and feedback you have, please use the Q&A panel, and we will address them towards the end of the session. And this live webinar will be recorded. So moving on, today we have three distinguished panel members with us to talk about the field of public health in general, the MSPH program at IMU, and the dual master degree pathway in collaboration with our international partner, the University of Arizona. So first, we have Associate Professor Dr. Akhil Mohammed Daher. He holds a basic degree in medicine and surgery, a master's and a PhD in public health. His main teaching portfolio includes epidemiology, biostatistics, and research methodology. Dr. Akhil plays an important role in the diverse clinical and public health research we conduct here at IMU and has numerous publications to his name. So to begin the discussion, Dr. Akhil, can you please talk us through some basic background of public health and what it covers?
Good evening, everyone from Malaysia. Thank you, Dr. Suhail, for the introduction and inviting me to share some insights about public health. Could you, next slide, please?
Yeah.
Okay, to start with, how could we differentiate public health from the clinical medicine? We are complementing each other, but we diverse by that. In public health, which is the science of preventing disease, promoting health and prolonging life, that we are focusing on the health of the society or the group or the population, rather than focusing our intervention on the patient themselves. Through our means is to empower the society or the community. And the meaning of empowering them is to provide them with the necessary knowledge, increasing their awareness about the disease determinant, causation of the disease, and the method of preventing the disease, and how to take care of themselves. By doing that, we will be shifting the responsibility from healthcare provider to individuals. The nations are troubled with the high cost of treating the diseases, so we cannot continue providing unlimited services. So the public health would be the discipline that will help us to shift the responsibility from the community to the individual to take care of themselves and to have a better health, with the goal of improving the health and reducing disabilities of the communities. And the end result will be healthier nation, better living standards, and better quality of life. Next, please. And I will be talking about why do we need public health. Sorry, the function empowering the people, achieving the goals of the public health lies in the three functions, which are promoting, protecting, and planning. So public health is concerned with the promoting healthy lifestyle, as I mentioned, by providing the necessary information, by explaining the determinant of the disease, and it works to improve the environment. explain the role of the environment to provide conducive environment for the practice of healthy lifestyle and control the environmental pollution and other related issues to the environment. And also public health usually acts to improve and ensure health equalities, distribution of the health care services and others, and also to identify the health determinants to the population, and also the main other function, which is the protection. It is well known that the procurement, the distribution of immunization, vaccination, immunization program is the main role of public health. And also public health acts actively in the screening program, early identification of the disease, and the prevention of the progression of the disease. Surveillance is one of the main functions. That means to be vigilant and to monitor all the non-communicable and communicable diseases. And it is well known that infectious disease control lie on the shoulder of public health specialists. An example of Malaysia, we have the vector-borne diseases from dengue to malaria. And the other main function, which we play an important role, which is the planning, which is planning for healthcare delivery, number of hospitals, doctor-patient ratio, mobilization of health resources, and also the management of health resources and how can we optimize our resources. Evidence-based medicine, also part of the public health discipline, which aims to generate evidence for better practice in the clinical medicine and in the public health discipline. Next, please, Dr. Sohail. All right, so let us consider why we are focusing on public health and why public health became an important. The main reason that we have witnessed change in the disease pattern and the distribution of the disease. From the mid of 19th century, we are witnessing a revolution of industrial revolution, with which the standard of living has increased, and we has changed from the active lifestyle to sedentary lifestyle, using cars, using the ITs, and with the advancement of the disease protection, with the improvement in the immunization, the provision of safe water supply, and the proper disposal of solid waste, there was a change from the infectious diseases to non-infectious diseases, what we call it the non-communicable diseases. This is coupled with increase in the age population because of the improvement in the immunization, in the treatment, in the detection, in the screening. This all has contributed to high number of non-communicable diseases. And these non-communicable diseases actually takes long time to occur, and it has identifiable risk factor that can be prevented. So public health plays an important role in the prevention and the control of these diseases. And let us show the distribution of some of these diseases. Next, please. Okay, considering the total death from the disease, if you could see the world, we have 55 million deaths. 18% of them only attributed to infectious diseases, maternal, perinatal, and nutritional conditions, and 8% attributed to injuries. However, 73.6% of the death all over the world is attributed to non-communicable diseases, which we just mentioned, that it has its identifiable risk factors. While in Malaysia, the picture is similar to the world, 18.2% attributed to the infectious diseases, perinatal and nutritional, and 73.4% of the death is attributed to NCDs. So we need an action. We need collaborated efforts between different agencies led by public health discipline to curb the death that is attributed to non-communicable diseases. Next. Okay, this is a picture about the total health expenditure on the main non-communicable diseases in Malaysia. And if we could see that diabetes mellitus cost the government around 4.4 billion ringgit Malaysia yearly, while the cardiovascular diseases cost the government around 3.9 billion, and cancer is 1.3 billion. And this picture actually reflects that the demand for the prevention, for identification of the disease are at early stage, before it reaches the clinical stage, before it reaches the hospital, which needs treatment, and then which will be followed by complications and other issues. And if you could see that cancer prevention has contributed to the reduction of the cost of the treatment of cancer. Next, please. And this is a summary of the risk factors or the causes of non-communicable diseases. And we could see that around 53% of the causes of non-communicable diseases is attributed to the lifestyle. And this lifestyle, it is the physical activity, healthy diet, smoking, alcohol, and increased weight and related risk factors. Only 16% related to genetic, 20%, around fifth of the causes attributed to the environment. As we need environmental health specialists, we need the proper planning of our environment and the prevention of the disease, and 10% actually attributed to the distribution and the delivery of healthcare services. All these signaling that we are in dire need of public health specialists, public health contribution to the prevention and treatment of non-communicable diseases and other diseases which are causing a large number of morbidity and mortality.
Thank you very much, Dr. Akhil. That was a very interesting introduction. With that, I would like to know for the participants here, what is the scope of a public health degree? Where does a degree in public health take the graduates?
Yeah, thank you so much for this question. Can I see the next slide, please?
Yeah.
Holder of public health degree, actually, they have an ample opportunities of employment in different sectors. Giving an example of Malaysia, the Ministry of Health, most of the departments of health are led or controlled by public health specialists, from the health service management to the environmental control, occupational health unit, vector-borne disease. And those also applied to the state health department and district health office. Most of the manager and the senior staff will be who are the public health specialists. National Health Institute, which control another 6 institutes, usually a place where all public health specialists are functioning and contributing to the health of this nation. Non-governmental organization from different scope, whether they are providing mental health support or other support, also is an avenue for the public health specialists to work. Higher educational institute, an example of the panelists in this webinar are public health specialists from educational institute. We are working as a lecturer and researcher. Research and development units, private pharmaceutical companies, and other private companies, all are good places for public health practitioners to contribute to the development of the nation. Next, please. And let me emphasize the role of the evidence-based medicine. All right, even if you don't see yourself that becoming a public health specialist, obtaining the public health degree, master or whatever, PhD, it will help the understanding the distribution of the disease and optimizing the intervention that we can provide to the patients. So public health, the specialist epidemiologist, research methodologist, and biostatistician are contributing to evidence-based medicine, where research is conducted, the outcome will be published, and it will benefit the clinician and others in the field to optimize the intervention for better health. So with that, I stop here. Thank you, Dr. Suhail.
Thank you very much, Dr. Akhil, for the informative bit. With that, we will move on to the next part of today's webinar, where I invite Dr. Nguyen My A. She is a senior lecturer at the Department of Public Health and Community Medicine and a doctor by background, and has the distinction of being an alumni of the MSPH program at IMU and now being the head of the program as well. She has been working in academics and research for the past 13 years and has extensive experience in designing curriculums and assessments. So now over to you, Dr. Nguyen. Please tell us about the MSPH program at IMU.
Thank you very much, Dr. Suhail. And thank you everyone for attending this evening sessions regarding our MSPH in public health. And thank you for your interest in our program as well. So what I'm going to share with you is about our program and what we offer and what are the modes and the pathways that providing to you from this degree, right? So could you go to next slide, please? So just a little bit about our IMU. So IMU is actually the first and most established private medical and health science university in Malaysia. And it was actually established since 1992, but we achieved the university status in 1999. So I can say that it's quite a well-established university. And we have also obtained the self-accreditation status in 2017. And from that year onwards, we are one of the private universities that achieved the Setara 6-star rating. Right? So currently we are offering 39 undergraduate programs, including 39 programs, including 22 postgraduate programs. And I believe there will be more programs coming up soon. Next slide, please. All right, so more about our public health program. So this is the Master of Science in Public Health. So what I would like to highlight here to the Malaysian audience is that this is not Master in Public Health. This is the Master of Science in Public Health, which is open to everyone who has the health science background and science background. So it's not only for medical doctors, which is offered by some of the private public university in Malaysia, right? So this is open to all the health science background holders. So it is MQF level 7, so meaning that this is created and developed at the master level. And what I would like to highlight here is we have two modes. Two methods of delivery. One is conventional. So I believe that conventional mode, everyone is familiar with that mode. And next mode is open and distance learning. So we call it ODL. So another thing that I would like to highlight here is our graduating credit. So we offer actually more than 40 credits, but for the students to graduate from our program, they will require minimum 40 credits hours, right? So this is the single major and the language of instruction is English. And we have already obtained Malaysian Qualifying Agency approval and approval from Ministry of Health. So both the conventional and ODL is approved by Malaysia Qualifying Agency. Next, please. All right, so in terms of duration of study, we have two modes, full-time, part-time. So this is both for a conventional method and ODL method. So for full-time, if you wish to take up the full-time study, you will have to spend 1 year. 1 year. So I also include maximum 2 years here. For full-time students, they must complete or they must take all the modules in the first year. So the next subsequent year is in case the students they need to defer the semester, or they for some reason they have to repeat or they have to extend. That is the next year, where they can complete the maximum duration. So part-time is very flexible. Minimum 2 years to maximum 6 years, and I would say it is very popular among the working students. So the unique features that you might want to know why IMU. So like I highlighted in my previous slide, IMU is well established, and public health MSPH is one of the first master program launched in IMU, and it is since 2011. And for the ODL, we launched it back in 2019, and I can say we are like 3-4 years old already. So we have conducted several curriculum review, and right now we are delivering the most recent or the new curriculum. So we'd like to ensure you that what we are delivering is the most recent and aligned with our public health requirements. And we also benchmark internationally and locally. Our curriculum is benchmarked as well. And if you ask me to compare between the conventional and ODL, ODL is of course a popular choice among the students who are working. And for conventional, it is popular among fresh graduates, or those who are taking career breaks, or those who wants to, for the international students, majority of them are willing to have the Malaysia experience. So that is the difference between the conventional and ODL. Right? Next, please. Okay, it's a little bit about program structure. So I believe since you are here today, you have go through our website, and you might have probably, go through our module list, what we are delivering, what are the modules, right? So the modules here, are also, cover the essential public health skill, especially in Malaysia's setting. And we develop our contents based on the program educational objective and learning objective. So actually it's the outcome-based curriculum, and we wish to train and equip the learners with a skill that they will be required in the work field of work. Right? So we the outcome-based, when we say outcome-based, they will become a work-ready graduate at the end of the study. So we offer core modules and elective modules. So you will see that core modules is equal to 34 credits, and there are a total of 11 core modules with a choice of 5 elective credits. So 5 elective modules. So in order for the students to graduate, they must obtain minimum 40 credits. So they can choose number of credits as much as they like, but minimum 6 credits will be required from the elective list. Next, please. Okay, so what I also want to highlight in the earlier slide is that we have research module as well. We have research module, and in Malaysia, all the public health program has research module. So where the student have to develop the research proposal, seeking, they will get exposure and experience in developing the research step by step, and seeking the ethical board approval by themselves. And they will be guided by the supervisors and mentor from the IMU, and all the students who join us, whether it's a conventional or ODL, they will be assigned a mentor each, and we will be guiding them through. So I believe most of you, or maybe some of you, might be interested in open and distance learning as well. So open and distance learning, how it is structured is like, if you have tried Coursera or Udemy in the past, you will understand this more. So we have a platform, audio platform, where we design and develop our curriculum content and put everything on the portal. And the learners will go through the portal. It's mainly self-independent, self-paced learning, and of course with the self-discipline and proper time management. So most of the working adults, they are able to do the open and distance learning. So what's the difference between the conventional and ODL mode? So could you go to next slide, please? So conventional, which is familiar to you, is face-to-face method. So in COVID era, we also have hybrid classes. So during the COVID times, during strict MCO, everything is conducted online. But in after MCO and COVID pandemic, after pandemic is over, we still have face-to-face with some hybrid classes, right? And conventional is where the students get to interact with the lecturers, peers synchronously, and they can enjoy the university life in campus. And this is for both international and local students. So for ODL students, so this is the preference for working students who particularly interested in part-time. This is popular because they can study anytime, anywhere, whether you are working in Saudi Arabia or Singapore or India or Pakistan, doesn't matter. You can do this. And or whether you are stationed in Johor or Penang or Sarawak, Sabah, it's okay as well. So all you have to do is you have to learn at your own pace, follow the instruction we uploaded, go through the guidelines, and follow the timeline strictly. And I believe that if you believe that, if you are capable of learning by yourself, are able to self-pace and self-discipline, this is very appropriate for you, right? So the only difference between conventional and ODL method is the mode of delivery, but the curriculum is exactly the same. All the teaching and learning activities are exactly the same. So for example, if you look at the delivery method here, instead of face-to-face lectures, they will be replaced by video lectures, recorded lectures, or other micro-learning materials that students can go through, and other learning activities provided on the portal. Right. Next, please. Okay, so now I want to introduce this to everyone, all the audience here today. We recently had have an international collaboration with University of Arizona. This is for dual master degree pathway. So what I mean here is that students who wish to obtain 2 public health master degree, they can join IMU and obtain our MSPH. After they complete it, they can move on to study MPH, Master in Public Health in University of Arizona. Mel and Annette Zuckerman College of Public Health offer this. So what's the good things about this? So University of Arizona recognize some of the credits. So for example, about 24 credits. And after students have completed master degree in IMU, they can move forward to University of Arizona and take another 20 credits to get the MPH from University of Arizona. So this is for part-time, full-time learners. 1 year in IMU and another year in University of Arizona. So we also have another distinguished speaker today with us. So I believe I will pass on to Dr. Suhail again to invite another distinguished speaker to talk more about it. Thank you very much for your attention and thanks for joining us today. Over to you.
Thank you very much, Dr. Lin. Yeah, thank you. Thank you for the brief introduction to the MSPH program at IMU. And now that you've mentioned the international collaboration we have, Joining us from across the continents is Dr. Gabriela Valdez, the Director of the Global Health and Global Education Programs at the University of Arizona, Mel and Enid Zuckerman College of Public Health. Dr. Valdez has had the opportunity to work in the field of international education for the last 15 years, teaching, creating, implementing, and overseeing many international programs in over 20 countries around the world. She has a PhD in international education and global perspectives from the University of Arizona. So over to you, Dr. Valdez. Please tell us about the MPH program at University of Arizona. I'll stop sharing.
Thank you very much for the invitation. I'm very happy to be here. Give me just 1 second to share my screen. Perfect. Are you able to see it now? Or should I swap my presenter?
Yes, we can see it.
Okay, perfect. Well, again, thank you very much for the invitation. I'm very happy to be here. I'm very, very excited to talk about this unique dual master's in public health degree in collaboration with IMU. We're definitely very excited for this partnership, and we think that many, many things are going to come of it aside from this specific dual degree program. But before I do that, I would love to talk and share a little bit of information about the University of Arizona, who we are, and also the College of Public Health. Just to give you a little bit of background, the University of Arizona is located in Tucson, Arizona. It was established in 1885 and is part of the Association of American Universities. We have about 3,000 faculty members, and overall we have about 50,000 students, including undergraduate students and graduate students as well. We offer over 100 different undergraduate programs, over 200 master's, doctorate, and professional programs, including the Master's in Public Health. We have over 120 countries represented through our student body, our faculty members as well. And we are physically located in about 375 acres in the heart of Tucson, Arizona. So we would love for all of you to visit us at some point. Probably not right now because it's extremely hot, but at some point it would be great to have you here. We are on the top 1% of institutions as far as grant ranking goes, according to the Center for World University Rankings, top 100 according to the World University Rankings as well, top 40 for public universities in the US. And also we're ranked 20th for public research according to the US National Science Foundation. We are a Research One institution, which means that research is definitely one of our priorities, and actually the majority of our full-time faculty members have to dedicate at least 51% of their time to research. That being said, students have many opportunities and great opportunities to engage in very innovative research projects and community programs as well. This partnership, specifically in the dual degree program, is offered through the Mel and Enid Zuckerman College of Public Health and the Global Health Institute that is located within the college. And we definitely take pride in educating the next generation of globally minded public health professionals. Just to give you a little bit of background about our college, we have a wide range of expertise among our faculty members, but there's definitely a focus on chronic diseases, including diabetes, obesity, cancer, health disparities, and community-based participatory research are part of the core foundation for the research that we conduct. There's also great activity with global health projects and global health research. We're only 1 hour away from the US and Mexico border, so many of our focus is binational and border health as well. And of course, we have projects and faculty members conducting research in all over the place. And we're hoping that through this partnership with IMU, we would have more research in that area, that region of the world. We also have outstanding service learning opportunities for our students. We focus on diversity, and we really think that is a core part of our mission, as well as providing opportunities for students through active student groups. And even though we are considered a small public health school, as compared to other schools within the world, within the US and in other places, some of the advantages is that students really have that opportunity to interact with the faculty members, engage in very meaningful activities such as research, community service, internship opportunities as well. Our mission, pretty much our college is dedicated to promoting the health and wellness of individuals and communities in the Southwest here in the US and globally, with an emphasis on achieving health equity through excellence in education, research, and service. We also think that we can only do this through collaboration with great partners, including IMU. And this is why I want to highlight this specific program, which is the dual master's in public health degree with an emphasis in public health practice. This is a unique opportunity. I think my colleagues here have highlighted some of the great benefits of engaging in this program. So just some specifics here. Our master's, our MPH, Master's in Public Health, is accredited by the Council on Education for Public Health, which is pretty much the highest accreditor in the US, and I would say probably the world too, as we increasingly see more public health schools trying to get accreditation from that agency. Because of that, our curriculum is competency-based. So there are a number of competencies you can see here. For example, these are the ones specific for the public health practice program that we can assure that our students will have those competencies by the time they finish our program. And one of the great things that has been mentioned before, but I also wanted to highlight, is that what we have done is that we have evaluated the courses that all of you will be taking in your IMU degree, and we're able to transfer about 24 units from your IMU degree to the University of Arizona. So you are able to complete a full MPH from the University of Arizona in pretty much 1 year. These are the classes that you see here. Just to give you an idea, these are the classes that will transfer to the University of Arizona degree from your IMU degree. So these would be the classes that you would be taking in year 1, assuming that you're doing this full time. And then in year 2, if you see the ones in red, these are the classes that you would be taking fully online through the University of Arizona. So for example, there's an internship or a master's report associated with the program. So you would have to complete that. There's a program here, a class in project design and implementation. There's integrated public health learning experience, fundamentals of evaluation. All of these classes in red are the ones that will be taken through the University of Arizona. As I mentioned, fully online, fully asynchronous. And then here as well, this is for the students who want to, the students will have the option of completing their internship throughout year 2, or maybe they want to focus on completing the courses first, and then they can finish during the months of May and July, they can focus that time to finish their internship as well. And then just to give you an idea of the duration of the Arizona program, for anyone doing the program full time, if they decide to start in August with an internship integrated during the year, they can start in August and graduate in May of the following year. The second option is for those students who want to start in August, but want to maybe focus on the courses first and do the internship at the end during May and August, between May and August. Then they can start in August of 1 year and graduate the following August. So pretty much 12 months. For those of you interested in graduating and starting the program in March, which I believe this is pretty much the next available start that we have, students are able to start the program in March. This is the University of Arizona program in March, and graduate from the program in May of the following year, so about 14 months. And then we will also have a part-time option that we are pretty much finalizing, but we are expecting that it would be an option of about 6 years for those of you who want to do it part-time, and that would include the IMU courses. So we're thinking that maybe students will complete the first 3 years, their IMU courses, and then the last 3 years will complete the University of Arizona courses. Just some important information that all of the courses are fully online. As I mentioned, they're completely asynchronous. So you do not have to log into a specific time as long as you're following and engaging with the content and engaging and turning in your assignments. We also follow the University of Arizona academic calendar, which means that for what we call fall semester, the courses would start mid-August and finish in early December. And then for the semester that we call spring semester, the courses would start in mid-January and end in early May as well. We also have great in-person opportunities here in Arizona. For those of you, as I mentioned, the dual degree program is fully online, but if you're interested in some short-term opportunities in Arizona, you definitely have the opportunity to attend the graduation ceremony in person, which I highly, highly recommend. And we also have, the students also have the opportunity to do their internship in Arizona. If they're able to contact a faculty member, find a specific public health community program or a research project, they can definitely do that during the months between May and August. Here's some information about our admissions requirement. There's a requirement of a bachelor's degree with a 3.0 GPA, and transcripts have to be submitted as part of the application. Also, the other way that you can satisfy that is by providing transcript of 12 or more graded units obtained as a graduate student at another institution. So for those of you who will be completing the IMU program first, you would submit the transcript from IMU. We also require for this program one undergraduate or graduate course in college biology or something similar. Anatomy can be another one as well. And then we also require one undergraduate or graduate course in college algebra, statistics, or more advanced math course. There's an English proficiency requirement, which I will talk about a little bit more. For international students, 2 letters of recommendation, resume, updated resume or CV, a statement of purpose and objectives, and mission and value statement. And we provide additional information about all these requirements once you reach out to us or to IMU. As I mentioned, for the English proficiency, these are the different ways that you can provide proof of English proficiency. You can provide a TOEFL test with a minimum score of 90 IBT. There's also the International English Language Testing System, IELTS, with a score of 7, with no subject area below 6. We also accept PTE academic with a minimum score of 60. For those of you interested in coming to Arizona and maybe having an English program before you start the MPH program, we have a graduate English language endorsement program. This is done fully in person. But I think probably the most accessible option would be the last option that we have here, which is the CEPT full academic test. This is a fully online test that is offered by the University of Arizona Center for English as a Second Language. And we require a minimum total score of 110. This is something that you can do fully online, as I mentioned, and it's only $40 as compared to TOEFL and these other tests that are usually more expensive. So some important deadlines: students must be admitted to the IMU program first. So that would be your first step. And then once students are accepted into IMU program, an application and all the required materials must be submitted to the University of Arizona no later than November 1st if you are hoping to start in March, or no later than June 1st if you're hoping to start in mid-August. Here are some of the steps for applying to the University of Arizona, but these we will be sharing with you once you apply and you are admitted to the IMU program first. Here's the contact information of our coordinator who can answer any questions or provide more information. And that's all I have. This is also my contact information. Feel free to reach out if you have any questions. Thank you very much.
Thank you very much, Dr. Valdez. That sounds very exciting, and it's a great proposition for people who are interested in studying public health. You know, a great chance to have an international exposure and learn from two top regional universities. You know, speaking of which, now the next important question that comes up is, which I want Dr. Ruin to answer, is the financial implication of higher studies. What is the fee structure like at IMU, please? I'll just share this slide. Can you see it?
Okay, Dr. Suhail, I will describe a little bit about it.
Yeah, I'll just reshare my presentation. Okay.
Okay, so the fee structure is for the Master of Science in Public Health program in IMU. For conventional program, you can see that, so for the Malaysian students, it is 1,000 per credit. And for the international students, is 1,250 Malaysian ringgit per credit. So for the ODL mode, it is slightly cheaper. And as you can see here, for ODL, 1 credit is 800 ringgit. And for the research modules, 1 ringgit is 1,000 for both Malaysian and international students. So basically the fees are same for the ODL learner, whether they are Malaysians or international. Right? So a little bit about the dual master degree as well. So what's the good news that I would like to highlight or give you here is for the dual master degree, the fees is 1 credit or 1 unit is $500 per credit hour or 1 unit. So in total, the students who go on this pathway, they will have to take a total of 20 credits. So meaning that the total tuition fees will be $10,000 only. So why I'm saying 10,000 only is that if you are going to University of Arizona independently and take the course there from from A to Z, you will have to spend about nearly $50,000 for tuition fees alone. That doesn't count the your accommodations and your expenses there. So that is the good news that I would like to highlight here. So it's a lot, cost effective pathway if you wish to pursue this dual degree with us and University of Arizona. So if you want more information regarding the the registration fees and the other fees that you will have to spend, you can always check with our admission department and also inquiry department, and on the website as well we describe it in details. That's it, Dr. Suha.
Okay, thank you very much, Dr. Nguyen. With that, we will now move on to the Q&A session. We have 2 questions posted. First one is, would the dual masters be accessible for working adults? Dr. Nguyen, would you like to answer that, please?
Sure. So definitely. So this dual degree pathway is for both conventional and ODL students studying in IMU, both for full-time and part-time, whether they are working or not working. So it is available and offered to all students.
Right, thank you very much. The other question is, what is the deadline for application for both the September and March intake?
Okay, I can take that one as well. So for the Malaysian students, you can still submit the application, because we are going to our enrollment days will be in the first week of September. So for the Malaysian students, it's still open, right? But for the international students, it is challenging if you submit now, because of the visa application. So visa applications, we cannot expedite it, because you need to give like about 2 months to process your visa for you to come to IMU and all that. So it will be a little bit challenging and late for you if you're an international candidate. But for the Malaysian candidate, you can still submit the applications for September intake and March intake. Does that answer your question?
Yes, I think so. Yeah. Thank you very much, Dr. Nguyen. With that, since there are no more questions, we come to the end of the session. Thank you all panelists for providing all the valuable insights. For the attendees, if you have any questions that come to your mind after the session as well, we encourage you to reach out to the admissions department at IMU or explore the university's website for more information. So thank you all once again for joining us today. And to all our prospective students, we wish you best of luck with your applications. And we hope to welcome you at the MSPS program at IMU. Thank you very much. Good night.
Thank you
Thank you very much.
Thank you.
Good night.
Thank you.
Thank you.
Bye-bye, everyone. Thanks. Thank you, Dr. Wallace. Bye-bye.